Hi, everyone. Welcome to Brain Talks by Being Patient. My name is Deborah Kahn. I'm the founder of Being Patient. For today's talk, we're going to talk about a difficult topic, the end of life for somebody with Alzheimer's, what that means, and how we can be better prepared. Joining me today, I'm really excited to have with me Dr. Liz Sampson. She is from University College London, and she has focused a lot of her research on end of life pertaining in particular to dementia patients. Also joining me is Jasja Kotterman. She recently lost her mother to Alzheimer's disease, and she wrote a very powerful article for Being Patient called What I Wish I Knew Before My Mom's Alzheimer's Death. So thank you both very much for joining us. I want to just start first with you, Jasja. Why did you feel the need to write this article?
That's a good question, actually. I actually was writing it. I wrote it to really help me deal with the grief of my mom's passing. It really was almost a cathartic experience to be able to put it down on paper. And I also was, during the last year of my mother's life, I'd been really struggling to understand what was going to happen to her in the last few moments, and how do I prepare myself and my family to deal with that. And so I thought maybe sharing that experience would be helpful for others, for caregivers who will, be going through the same thing.
And Liz, you are a medical doctor. Tell us about, this is a really hard topic to talk about, but it was one that really resonated with our community because I know, I have a mom who's been diagnosed with Alzheimer's disease, and I don't know what the end of the road is going to look like. So from a doctor's point of view, first and foremost, tell us really what happens to the brain when someone dies of Alzheimer's.
It's a really complex issue, and I think one of the problems is that often we don't perceive the fact that dementia and Alzheimer's disease can be a life-limiting illness. And so because of that, we don't discuss it in the same way as if someone's just diagnosed with cancer or another illness that's considered to be, terminal. I think everyone's very different, and it's a very individual journey for people. And there's an added layer of complexity because lots of people with dementia or Alzheimer's disease, because they're elderly, they might not even live to the advanced stages of dementia. And many people will die from other causes such as, heart failure, stroke, accidents, all the other things that we're all at risk of dying of when we get older. What we know is that about a third of people, roughly, with dementia will reach the more advanced stages and die in those advanced stages. And really what's happening in the brain then is that very much parts of the brain are being affected that control our more basic functions. So, for example, in the early stages of dementia, people will have memory problems, and then in the moderate stages, they might have difficulty with relating to other people and their relationships, and perhaps their behaviour and their distress becomes an issue. And then as the brain cells die off more quickly, more fundamental parts of the brain become affected. So the parts of the brain that coordinate movement may become affected, and that may mean that someone is unable to move around and ambulate and they're in bed all day. A really fundamental issue is when the part of the brain that coordinates our swallowing becomes affected. So we all take swallowing for granted. It's a reflex and it's something we do without thinking, but actually it's a really complicated process. And in the more advanced stages of dementia, the brain becomes unable to coordinate what the mouth's doing, how the swallow's working, and then the food can go down the wrong way and start to cause pneumonia and problems like that. As people become more unable to move and they become less able to shift position, they may be more at risk of bed sores. And gradually the body is just shutting down as the brain becomes more and more affected. And that's a difficult process because it's very, very unpredictable. And there's very, very little research in this area compared to the research that we have on all the early stages of dementia. And I think that
go ahead. Sorry.
Really important that we acknowledge that there's uncertainty, and as professionals and as someone working as a clinician, one of the major things that we can do is actually say, well, we don't actually know how this is going to pan out, but we will work through it with you and make sure the person is comfortable at all stages when these things are happening.
So your connection's going a little bit wobbly, but we got most of that just towards the end. But Jasja, I just wanted to talk a little bit about your experience. I mean, it was now thousands of people around the world have read what you wrote for Being Patient. And I guess reading a lot of the comments, what struck me is how many people said, I had the same exact experience. So part of me started to think, and a lot of the reaction was like, but I wasn't prepared for this either. I didn't know what was going to happen. So I guess what I want to know from you are two things. It's like, tell us a little bit about the experience with the end of life with your mom, and tell us what you feel like, what was in hindsight so important to know.
So I think with my mother, the last stage went really, really quickly. And I think, interestingly, we had been told that she could be in stage 7, or she could be in these last stages for 6 months, a year, even 2 years. But in actual fact, I think from the time that we realized she'd moved from 6 to 7 till the time that she passed away was about 3 months. And one of the things that the doctors and the caregivers in the home told us was, because my mother was on the younger side of someone with that disease, that it progressed more quickly than if it was an older person. And actually the caregivers in the home were surprised how quickly she progressed into that last phase. I think for me, when we were with my mother, it was really important for the family to be with her at that last phase. And I think it was, I think we were very lucky that we got really good help from the doctors and from the caregivers in terms of giving us time frames of how long it would take, giving us some expectations of what was going to happen next. But like Liz said, I mean, you know, we couldn't be given exact days or exact timelines or exactly what was going to be happening, but just these are probably things that will happen, and not always in the same order. So, so that was actually surprising to me. So my mother, the first time I noticed that something was going on was when she just had difficulty walking. And my mother was a very fit person. So the fact that she was having trouble walking was a bit of a shock. And then with the walking, she became less mobile, and I think her circulation problems started, and then the bed sores started, which with her showed up in blisters on her ankles. And then very quickly after that, she just stopped eating. Well, not that she stopped eating, she just was having real difficulty eating. And I think I almost felt as if she couldn't figure out what she had to do with the food in her mouth, if she would just chew it for a long time. And then she seemed to be almost afraid to swallow. And I think then she just stopped eating and refused all food and water, and it was really hard for us to feed her. And so that went on for about a week or two. And so we were really scared that, yeah, she was just gonna, wither away and stop eating. So it was great for us when she did start eating again, but I think that was really when she probably asphyxiated or not asphyxiated, where she swallowed the food in the wrong way. So what was, like I said, what was helpful was that we had so much guidance from all of the caregivers and the doctors that we were told, what to expect. But I have to say what was frustrating was that it wasn't more specific, right? And so as a family member, especially if you're traveling from far, you don't know how long to plan or to take off time from work. So that was difficult. But I mean, I understand that everybody is different.
Now, one of the things that you write about in the article is when your mom was administered morphine, you didn't realize that this is the end.
Right. Yeah, I don't know why it didn't click with me. I somehow thought that with morphine you would still be conscious, but not in pain. Actually, it'd be a question I'd love to ask Liz as well about that, because I had heard of people being on morphine as to help them with pain, but that they were still able to talk a little bit. And so what really surprised me was that she just never regained consciousness after that. And I'd love to hear Liz's opinion on that, actually.
Yeah, Liz, is that common? Is once you're administered morphine, should someone expect that's really the end?
I think it's very difficult to tease out what's the morphine, which can make people sleepy and sedated, but also makes them more comfortable. So it's difficult to work out, is it that, or is it the fact that the person is actually dying and that's why they're not conscious, but they're comfortable with the morphine? And that's a really tricky issue. But what I would say is that the main goals of care really are to keep someone comfortable and to alleviate distress, and it can help them feel that they're breathing more easily. And so it's a very different situation where you might have a younger person with cancer who is on a small dose of morphine but is up and about and able to talk. When someone's in the very advanced stages of dementia, it could just be that they're going into the process of dying. And what Jasja said, which is a really important thing to pull out, is that we have this concept of dying from programs like ER, and we see in the media that, we'll suddenly clutch our chest and keel over and that will be it. And what we don't see in society nowadays, and what people understood 100 years ago when more people died at home, is that it's a process. And it's can be a very slow journey over a few days or a week as the body is gradually shutting down. And that's an absolutely normal dying process. But we very rarely see that or talk about that in society in general, not just related to dementia. So it could be that that's just what's happening anyway, and the morphine is just alleviating any extra distress that's associated with that.
We're getting a question about what you should expect, or I'm going to reframe it a little bit. What questions should people ask their family care doctors about this stage of life? Like what are the best questions to ask in order to prepare us for this very late stage?
I think the best question to ask is, how can we keep this person comfortable and maximise the quality of life that they have today and for the next few days, and how can we best maintain their comfort and their dignity and what they would want? Not to get hung up. I know it's really difficult if you're abroad and you need to know timescales, but not to get hung up on this how long have we got question. Where do we give this care? It's about focusing on the person and their needs, if they've had any previously expressed wishes, and really focusing on maintaining their comfort and the quality of the life that they have left. So for me, the ideal family question would be, how can we do that? How can I keep my mother or my father the most comfortable and the most free of distress, rather than thinking, how long is this going to go on for?
I'd like to add something to that. That's absolutely correct, at least from my experience. But what I found really helpful, which I asked to the doctors and the nurses, was what could I do as a person around my mother to make her more comfortable? And at what point does the medicine not provide all of the comfort, be it spiritual or family or whatever it is that's important to you? So because you are waiting there and you feel a bit useless, and that actually was also a bit frustrating. And so we were told, this was actually really helpful, very small thing, but it was very helpful. Take a Q-tip, put it in lemon water, and just rinse her mouth just so she gets a little bit of humidity and it keeps her mouth fresh. And that was, we would take turns doing that. It kept us busy. And just, holding her hand and talking to her. We played a lot of music, which was really important for my mother. And we really enjoyed that. And so we hoped and thought that would be good for her as well. And so it was good to ask those questions as well of the doctors in terms of, what else can we do to help? I mean, the medicine helps so much, but what else can we do as family and caregivers?
Jasja, were you able to gauge really how much pain she was in that final stage?
No, my mother was a very strong person. She had a very high threshold for pain, and I think I wrote in my article that we were always concerned about her comfort. We were always asking her, and she would always say, "No, I'm fine, I'm fine." But it was that last day before we administered the morphine, where she was, pointing to her chest, and she was nodding when we said, "Does it hurt?" And so. We could tell that she really was in distress then. But once the morphine was administered, it was a bit hard to tell. I mean, she had very labored breathing, and so I was worried that was, causing her some stress. And again, the doctors and the nurses were very helpful in telling us that that was kind of normal, and that she probably wasn't feeling any discomfort. And so it was two and a half days that we held vigil with her on the morphine, and I think she was comfortable during the whole time, and that was really comforting.
Liz, do we know how much someone who's dying from Alzheimer's can understand what we're saying when we speak to them? Do we know what happens to that part of the brain? Are they able? I mean, we know memory is gone, and a lot of times people's abilities to speak is gone, but can they understand?
We know very little about how aware people are, but what I would say, which really relates to what Jasja just said, is that you can get very hung up thinking about medical things, but actually at a very basic level, even with someone with advanced dementia, they are aware of the atmosphere around them. So if things are tense, if people are distressed around them, they will pick up on that. It's about thinking holistically. So they may preserve certain senses. So their sense of smell may be very well preserved, which is why using aromatherapy and all of those things, there's no real evidence in clinical studies, but actually it's just comforting to be surrounded by nice smells, by music they like. All of those things reach the more inner parts of our brain, which trigger more basic emotional responses in us. So there's good reason to think that taking all of those approaches, the sound of a familiar voice, holding someone's hand, is going to register with them on some level. But also for the caregivers, it's about thinking that it will improve their experience of the dying and the grief. And we have a famous woman in the UK, Cicely Saunders, who started the modern hospice movement. And she said, the memory of how we die continues in those who live on. So in a way, we want to provide a good death for person dementia, but actually doing all of those other things is really important, because it then means that the relatives and the carers will have a different and hopefully better grief experience than they would have had otherwise.
That's really true.
So we're getting another question as well about community-based care. Is that a better option than taking care of someone at home? Is it better to have support around you? I mean, and I think both of you can answer from different perspectives.
Well, I'll just talk about my experience. My mother didn't die at home. She died in a care home. And I actually think there was no other option for us. We wouldn't have had her in our home. We just knew that, very importantly, we didn't want her to die in a hospital. And so it was important because we did have some support for us as well. The nurses came and gave us meals, and we didn't have to worry about that. So I almost felt like we were being taken care of as well, which is really, really appreciated. You could always ask for help if you needed to. The last few days we needed, before she was on the morphine, we were just trying to figure out different ways of getting liquids in her, and so we'd be able to get some advice. The doctors weren't always around, so it was helpful to just talk to the other people in the home. And so I think if that's what you mean, if that's what the question is about community, I think that is good to have someone with experience and to be able to guide you through the process.
Liz, do you want to add to that?
I just think it very much depends on what country you live in as well and what services are available. But I think that ideally everyone wants to try and keep their relative at home, but sometimes it's just not possible. And I think that, again, ideally we don't really want people to die in hospitals, but actually we can get very hung up on the place of death rather than thinking about the quality of what the care is given there. And my father had severe vascular dementia, and he died in hospital, and that was beyond our control, but actually he had a really good death. So it's thinking about the comfort and the care provided rather than the actual place, because the problem is that relatives can feel very, very guilty that someone has to go into a care home or a hospital, and that's another layer of burden on them. Whereas if you think about it more about providing the best possible comfort and care wherever you are, then you can become less worried and less upset by the fact that someone's had to go into a care home.
So we have another question from a viewer who said, what I would have liked to know is how some of the signs of approaching death translate with dementia. So Liz, are there signs we really should, because you're always guessing, this disease Alzheimer's presents itself differently in terms of the progression in different people. And I guess you're always looking from stage to stage, what stage am I in and what are the signs? So when we're talking about it in the context of end of life, are there signals, are there signs that this is really, that death is imminent?
As we said, people progress differently, but I think certainly one of the key signs where you really have to take a step back and start thinking, are we reaching the end here, is the not eating and drinking. And that happens for lots of reasons. But once someone stops wanting to eat and drink, that's often a sign that you are reaching the end of life. And whether that's going to happen in a week or a month, that's often the person saying, in a way, I've had enough, I don't want this anymore. It can be very upsetting for carers and relatives. But the studies that we have in patients dying from other illnesses is that actually it's not a horrible process. The last thing you want to do is to start artificially tube feeding people, because that's not really been shown to prolong life. It's about thinking again about that quality of life. So clinically, as a clinician, if someone stops eating and drinking, and Jasja gave a perfect example of that, the memory becomes so bad that people don't know what food is anymore. So to them, food in their mouth is like a foreign body. They might spit it out. They might not want to swallow it. They might forget to swallow. When someone reaches that stage, that's a sign that things are probably more imminent. If they're having recurrent chest infections, if they have a serious illness, that can often be a sign as well.
So we have another question coming in saying, Jasja mentioned how the hospital can be a difficult atmosphere for your loved one, and Dr. Sampson said it's more about the level of care. Since we've heard hospital visits can worsen people's dementia symptoms, what should people do to ease the transition for their loved ones back at home after they've had a hospital visit to minimize their symptoms? Also, is there anything they can do in the hospital to minimize their confusion?
There are things that you can do, and one of the things that we use, we're particularly using more in the UK, is simple documentation. So we use a document called 10 Things About Me, or This Is Me, so that when a person with dementia goes into an acute hospital, there's a really simple document with, this is my name, this is what I like to be called, this is what I like to eat, this is the music I like to listen to, and it can really improve the person-centered care that the person in hospital has. and it can alert the hospital staff to all the extra comfort care that can be given, and to see the person as a person rather than just someone with dementia. So that's something where carers can be really, really active in terms of when someone goes to hospital. It's about putting up pictures of your relatives, so bringing in photographs from home, anything which really highlights what the person is, who the person is, what they were before, and makes that connection to that personhood, can be very, very useful for clinical staff. And I think there are other things that can help, like taking someone's clothes or familiar objects into the hospital, so that when they come out of hospital again, they're in the same clothes or they've got the same familiar objects with them. Thinking about those transitions is really important.
Liz, what do you find with your research and with your care of patients? What's the most common questions about this stage that come up? I mean, I know you're focused a lot on the end of life. So where do you feel people aren't getting the right type of information that they perhaps need better information?
I think it's very much about what we've discussed already. How long is this going to go on for? It's very much about carers worrying that they're not interpreting the signs. You know, how will I know she's in pain? How will I know what to do? I think there's a real tension, actually. I think it's very easy to look back and think, I wish I'd known more. But what we find is that often in our research, and also as a clinician, is that when you try and introduce a discussion about end-of-life care, understandably people aren't ready, they don't want to have that discussion, they want to live positively. In the UK, the message is about living well with dementia, and that's really, really important. But I think that sometimes it's really easy to look back and think, I wish I'd known, and be very hard on yourself. But actually, you were doing the best that you could do at the time. And our research shows that there's very much a shift that goes on throughout the process and after someone's died. That's very difficult to address.
Right. Yeah, go ahead.
Actually, I found our doctor asked us something which was really, really good, and in a roundabout way gave us some indication that we were reaching the end. Probably about 5 weeks, a month, 5 weeks before my mother passed away, the doctor called us and said, you know, I think as a family, you should have the discussion now about how you want your mother's life to end. And it was very confronting, because we really had thought she had another 2 years. And so we thought, oh my goodness, you know, now we really have to think about it. And it was, I thought, done in a very good way. She said, you know, have a discussion with your family, and then I'll have a discussion with you guys. And so then we were ready to ask her the questions of what are the options? Do we go into the hospital? Do we not? What type of care can be given at the care home versus not? General timelines. And I thought that was a really, really good approach from the doctor, to just give us a heads up and to say, think about it, and then let's talk. So I found that.
Jasja, did you talk to your mom about what she wanted for end of life in an earlier stage of the disease? And if so, like, I think, you know, I wonder if I should be talking to my mom, which I haven't done, because it's a hard thing to broach when they're not, you know, my mom still in her mind thinks she's okay. So it's a really difficult thing to broach.
Yes. Luckily, my mother had always been very specific all through her life as to how she wanted to die. It was actually very easy. She told us how she wanted to be buried. She told us how, and we knew this way even before she was even sick. It was just something that was always discussed with her in reference to how her parents had died and how she wanted us to treat her when she died. So for us, that really, really helped, because we knew what she wanted. Specifically, when my mother first got sick, my father decided not to share her disease with her. So my mother was actually, for a large part of the time, really oblivious to the fact that she was sick. And even when she was being tested by the doctors, my father would come out and say, oh, you know, you did really well in the test, and the doctors are saying you're fine. When we put her into a home, He even said, look, you're just going in for testing. The doctors want you to stay for a couple of weeks. They need to monitor you, but then you're coming home. And I have to say, as my sister and I really had issues with that approach. We thought we should be more honest with her so that she knew what was going on. Actually, in retrospect, I think my father's approach was the better one. It was a more compassionate one in a way, because she did then forget why she was in the care home, and she got comfortable. But that fear of going into the home was lessened, and so we never really had the conversation with her while she was sick, because we also had enough of a discussion with her before that. But I think you do need to have that discussion earlier rather than later.
Would you agree with that, Liz?
Absolutely. And the thing is, we should all be talking to our parents about what they might want, whether they've got dementia or not. In fact, we should all say what we would want anyway. You know, there's a big taboo in society in general about talking about death, and any one of us could be knocked over by a bus and end up in intensive care, and our friends and family might not know what our wishes are. And I think that there are some really good public health campaigns around just opening up and having that really simple discussion about what would you like. And I think people get very worried that they have to write it down on a piece of paper and have a clear legal documentation or an advanced care plan. And that can help, but all of the studies show and practical experience shows that it's just having that discussion. And it might be taking the opportunity when a family friend dies or someone else dies or there's something on the telly to say, actually, what would you want? What do you think? I would want this. What would you want? And it's just opening up that discussion is so valuable when you reach the more advanced stages.
So if you haven't had that discussion yet, and you just receive a diagnosis, a family member just receives a diagnosis, then would you say that's the right time to bring it up, like right at the beginning stage?
I think yes, if we can do it in a sensitive way, then, and it's very difficult. The problem is as always, this is very different to cancer, because we know that lots of people who have dementia, and perhaps it's a blessing, who knows, don't have insight into that, because the part of the brain that gives us insight and self-awareness is affected quite early on in dementia. So sometimes you can try and introduce the topic, but it can be very difficult for people who are in the early stages of dementia to visualise a future self and what they might want in the future. But you can keep it very general and say, well, oh, was that a good idea? What happened with that person? What would you like? And you can have an idea, and just to think and discuss with your siblings or other members of the family, and have a general discussion can be very, very helpful. But not to put too much pressure on the person with dementia, because they might not be able to think about it. It's actually quite conceptually difficult to think, what would my future self want? So a very gentle discussion and an opportune moment can be very helpful.
Jasja, what do you what insight can you give us from, having to, you were there and present when your mom was dying, and in hindsight, if you had to tell someone, if you had to relate this experience to other people who are impacted by this disease, what would you say are the most important things for them to consider preparing for this last stage?
Are you talking about, what would I say to people with the disease, or carers?
No, with carers, loved ones.
Yes, I think one of the things that we learned, which was really helpful, was to always be thinking ahead. You know that this is a progressive disease, and so educated about what is next, and prepare for that stage as early as you can. So for us, we knew that my mother would need some care at home. My father was very resistant to that, and we worked really hard to get him ready for that. And it came to that we then, at the point that he realized, yes, he needs some help, we already had contacted family friends who could suggest someone to come and help in the home. And then we knew that at some point she would have to go into a care home. And my sister and I spent a long time looking for the right care home. It probably took us 2 years to find the right place for her. And we had to go on waiting lists. And I'm so glad that we did that so far in advance. We always kept thinking, well, let's at least just know, and it'll be in the future, because the step change for every phase just came so quickly at the end, and it was always a surprise. And so I felt like it would have been really bad if we hadn't been prepared, especially when we did put her into the home. It really was, we realized within a space of 2 months that she needed to go into a home, that my father and the help at home just wouldn't be enough to take care of her at that point. And so luckily we'd had a place already reserved that we could try and get her into. The same with, when sort of the incontinence happens, we needed to be ready for that and helping my mom deal with that. So it was, that's why I found it really useful to know what the next stages are, and to, as a carer, not be thinking, okay, this can, it'll just be like this for the next few months. To your point, Deborah, when do you have that end of life discussion with your mom? I think it's always earlier on all of this stuff, the better. So you're better prepared for when it comes, because when those step changes happen, they just happen so quickly, and it surprises you.
Liz, I see you nodding your head. I wanted to actually ask you, because before we started the live conversation, when you and Jasja were speaking to one another, you said that you actually found her article interesting and insightful. You as a doctor who practices it, just tell us a little bit about that. What was it, looking from her perspective, that you found helpful or interesting?
I think the fact that she was actually talking about the end of life in a very open manner, and the way that I got a real sense of your mother from that, the person that she is and she was, and I think that really struck a chord with me. And the fact that you were a family very much working together to try and really do the best that you could. And as I mentioned to you both earlier, it struck a chord with me because I'd been in a similar situation with my father, and given how common dementia is, it's highly likely that even your healthcare professionals are dealing with similar issues in their own families. So I just think that it was really good to see that verbalized and written as a story. And there was kind of I don't want to say, it's difficult to express, but kind of a positivity. I think that again, because of the taboos around death, we don't write about what a good death is. And I got the sense that your mum had a good death. And
Yes.
I think that's really, really important. And that's what we try and do clinically. It's what we're trying to think about in our research, and also just as human beings, is that we celebrate a good birth, and we should celebrate that someone's had a good death as well.
I think, Jasja, one of the things, sorry, I don't want to interrupt you, but it did strike me too that there's a beauty of having you all of the family members around your mom, that there was something very beautiful about that when you wrote about it.
It was actually I think I said in my article, the last 3 days that we were together, and we really just were in her room sleeping on mattresses, on whatever we could sleep on. We just didn't want to leave the room. And there was something very, very good about that, in that it was, the strong family bond and feeling, and that we were all there for my mom at the end, and that we were there as a family. We started as a family, and we were going to end as a family with her. And so, I think a large part of, as a carer later on, is part of the guilt that you feel of, oh, I should have done this, or I didn't do that. And I feel like the four of us, or the three of us, can feel good about how my mom died, and that was really important for us, and a great relief. And I think my mom would have appreciated that as well, that it was good for us.
Yeah, absolutely. So I want to, for our viewers, if you haven't read Jasja's article, please do so on beingpatient.com. We continue to get a lot of traffic, and as I mentioned, a lot of really positive comments. And as Liz correctly points out, death should not be an inappropriate topic to discuss, especially when you're dealing with a disease like Alzheimer's disease. I want to thank you both very much for joining this conversation. Dr. Liz Sampson, who deals with end of life with dementia patients, joining us from University College in London, and Jasja Kotterman, who's joining us from France right now, from the south of France. I really appreciate the time that you've given Brain Talks on being patient, and we will look forward to continuing to get insight from both of you, and thank you so much for joining us today.
Thank you for having us. Thanks, Deborah.
Thank you.
Okay, thanks.